Hello everyone, my name is Professor Marlen Sinclair and I'm the head of the Maternal, Fetal and Infant Research Centre at Ulster University. Today I'm speaking to you on behalf of the research team from the Department of Paediatric Cardiology at the Royal Belfast Hospital for Sick Children and the Ulster University. Our research study is about Tele-Home-Care using a new video conference app for babies and children with congenital heart disease during this COVID-19 pandemic. The research is funded by the Ulster University and by the Children's Heartbeat Trust and supported by the Belfast Health and Social Care Trust. A little background information. Northern Ireland has a birth rate of about 24,000 per annum, and we would expect to see around 200 babies born every year with a congenital heart defect. Of these, approximately 120 will require surgery. If you look at this picture, you'll see this is the actual Tele-Home-Care conference taking place at the Paediatric Cardiology Department in the Royal. You can see our specialist cardiac nurse, Rosie Brown, on the right side of the video, interacting with the mother and baby. Each video consultation is conducted by either a specialist nurse or a doctor from the paediatric cardiology team, and it involves a clinical assessment of the child's well-being as well as a discussion with the mother. Many of these families will be supplied with a home oxygen saturation monitor, and readings from these are an important part of the video consultation. The Paediatric Cardiology Department has a long history of using telemedicine for home monitoring since 2003. That was Cross and Nadal's work. However, the old technology required installation in the home and was limited in terms of time taken to set it up and the quality of the pictures. In response to the coronavirus pandemic, the team have expanded the service and to use a new app called PEXIP. Now, PEXIP is a video conferencing platform that has enriched data security standards and is fully GDPR compliant. It can be easily accessed via the PEXIP app and downloaded onto any device. PEXIP allows efficient bandwidth utilization regardless of where the meeting and participants are located, and this ensures high quality video and audio for all the video conference participants. This study is taking place at an important point of time when the General Medical Council is calling on doctors to triage and treat patients by remote consultations wherever possible. The response to the COVID-19 has led to the rapid uptake of PEXIP for video conferencing for paediatric cardiology patients at the Royal Belfast Hospital for Sick Children. The ease of use and the acceptance of the technology increases with increased experience. However, it must be assessed and monitored to ensure it meets the needs of the children, their parents, carers, and the clinical staff. It's essential to have confidence in the safe and effective usage of the online system. This is particularly important as video conferencing may need to be used now for extended periods as changes in care provision are made in preparation for future waves of COVID-19. I know we've had 3, but who knows how many we may have in the future. It's also important to understand how children, their parents, carers, and healthcare professionals respond to care provision online compared to in-person face-to-face care. The evidence indicates that some people may experience practical barriers such as technical challenges with the software and hardware, resulting in barriers to the adoption and acceptance of the technology. Now, our study design is quasi-experimental and prospective, and the participants are babies and children up to 16 years. The intervention is the PEXIP technology, and the primary outcome is the number of unscheduled attendances or admissions to hospital of children using the PEXIP platform. We're recruiting mothers, babies and children from 2 main sources, the paediatric cardiology ward and the outpatients clinic. We focus on the babies with the more serious conditions for whom close monitoring and follow-up is essential. We're collecting data at 3 specific time points before and after the first video conference, the 4th and the 8th. This is pre and post video conferencing data to explore expectations and outcomes from the video consultation. We need to do this over a critical time span to obtain important data about the quality of the technology, ease of use and its acceptability. We're collecting both quantitative and qualitative data, and there are 3 layers. Quantitative data will include the demographic information and attitudinal data from the adapted unified theory of acceptance and use of technology instrument as a valid and reliable instrument. Qualitative data will be obtained from the post-video conference chats with the researchers and the invisible private Facebook posts. Additional quantitative data will come from the clinical record and will include the number and reasons for hospital attendances and admissions, as well as physiological data collected during the video conference sessions. Due to the time-sensitive nature and the immediate need for the service to get up and running and to limit the potential of COVID-19 transmissions, the project was developed and launched within 5 months. We recruited our first participant on the 20th of October. I'm just going to give you a little bit of almost a bird's eye view of where we're at with the project. So to date, we have 9 parent-child dyads and 10 parents taking part because we have 1 father in the study. You can see the educational status is very good and the gender balance of the babies, 4 female and 5 male, is also very good. We have no older children in the study at this time, and the babies were recruited to the study somewhere between 6 and 77 days old. I know this is a very busy slide with a lot of data, but please take a second just to scroll your eyes down through it. All of the children included in this study have been born with major congenital heart defects, and the spectrum of diagnosis is as listed in the slide. Some will have additional problems, such as those with Down syndrome. All of the children will require at least 1 surgical procedure. The Home Telecare project allows the clinical team to enhance the care of these children, particularly in the pre-operative phase. It can provide an early alert system for any potential clinical deterioration requiring hospital attendance or admission. The key point to make is that these babies are in need of highly specialised cardiac care, and in these difficult times of COVID pandemic, this programme is significant in helping to deliver that care. Moving forward to look at some of the other data now. This slide shows baseline data on the experience that parents have with the technology. And you can see there's almost a 50-50 split for their experience of using smartphone and computers. Of note is the high level of experience in using video chats. Following the PEXIP video consultation, the data indicates a positive trend towards the value of the intervention. This was supported in the video consultation with the researchers. All participants had used a handheld device. All reported good video quality. Only 1 person had a problem with the audio, and this rectified itself. We collected data from the parents about their experience, and here are some of their words. The key points include a focus on how convenient it was, easy to download, protects from exposure to COVID, and offers reassuring support. These particular comments demonstrate the visual power of the technology to not only reduce anxiety, but it also lets the medical team see the symptoms being displayed by the baby. The mother of the little baby described above has provided a video clip to go with this presentation, and I hope you will listen to it at the end of this slideshow. Our next steps are to make our invisible and private Connect Cardiac People Facebook Live. The purpose of this Facebook is to provide peer support to the participants and gain insights into their experience of being in the project and listen to their views on further paediatric cardiology research. It's definitely not designed to provide medical advice, and this is made clear to all of the participants. To date, all parents have signed up, and Julie McCulloch and I, Julie's a major researcher on this project, we're very grateful to the parents for saying yes, so thank you very much. Now, I'd like to finish this session and just invite you to join us in listening to Anna's story. It'll start in a moment. When Anna's finished speaking, the team will be available for questions, so hopefully you'll have some questions and we'll be able to answer them. Thank you very much.